Hello, my name is Andy. I'm from Cleveland, Ohio, and I'm here to talk about artificial disc replacement. Over 2 years ago, I had some serious problems with my neck. I started having pain in the back of the neck, which went all the way down the right shoulder to my fingertips, which were getting numb. The pain kept me up at night. It gave me a lot of problems when I would sit in front of a computer, and several other symptoms that I had going on. Well, I initially went to a neck surgeon who had me get an MRI and diagnosed me with stenosis of the neck, which is a narrowing of the canal that the spine goes through. Well, he sent me for some nerve block, which the first set of nerve block worked, and the second set didn't do me any good. So I got my MRIs together and my x-rays, and I consulted with several other doctors here in the Cleveland area, and within New York and a couple other locations actually. And what I learned was every doctor wanted to do a fusion. The best case scenario, a 2-level fusion, and the worst case scenario, a 4-level fusion. Well, I learned that each level that is fused, there's a possibility of losing 10% mobility. Well, me being relatively young and avid motorcycle rider, this certainly isn't what I wanted. So I took the time to get on the internet and do some research. And I learned about artificial disc replacement. And what that is for the vertebrae and the disc that they take out, they actually put an artificial disc in to replace it. Now, this procedure has been going on overseas in Germany and India for over 15 years now. Unfortunately, it's relatively new in the United States. Now, in Germany and India, you could get a multi-level disc replacement because they've been doing it for so long. But in the United States, the FDA has only approved a single level. And so that means that insurance companies will not cover multi-level, but they will cover a single level. So during my research, I located the LA Spine Institute. They're located in Los Angeles, obviously, and Santa Monica, California. I talked to Dr. Hun Bae, and you spell his name Hyunbae. Well, after talking to him on the phone, and after I had sent him all my materials, Dr. Bae asked me to come out to see him. So I took the time to go out to California at Santa Monica and see Dr. Bae. My consultation with him was great. He looked at what he can do, and he told me what he would like to do is what he calls a hybrid fusion. And that means he will put a single level artificial disc in and the 2 lower levels, and now I'm talking about the C4-5, 5-6, and 6-7. So the 5-6 and 6-7 he would put in what he calls, in layman's term, is a wedge. And if you could picture a door jamb, that's basically what this wedge looks like, but it's made of carbon fiber with a titanium bracket on the end of it that screws into the vertebrae. And over time, the wedge and the 2 lower levels that are wedge will actually fuse, but the artificial disc will never fuse, and it will protect all the levels above it. That's in the theory anyhow. So Dr. Bae is also an expert in minimally invasive surgery, and so his surgery is all conducted under a microscope, and he definitely does not touch any unnecessary nerves or any unnecessary tissues. And by doing that, it really takes away a lot of the pain that you would have after surgery. So anyhow, I'm sitting here in front of you 9 days after surgery. I had the surgery done on December 13th, and today is December 22nd, in 2011, by the way. So 9 days after surgery. My first day of surgery, when I came out of surgery, which lasted approximately 4.5 hours, only because there was a little more to it than Dr. Bae expected. I had a lot of bone growing over bone, and he literally had to break my neck in 3 places in order to repair it. So that took him a little longer than expected. So I was in there for about 4.5 hours. I came out of surgery, I woke up, I was in a soft collar. I was able to swallow somewhat. I was on a liquid diet for the first day. Within the second day, the collar was off my neck, I was up and walking around. I was on regular food. I still had a little bit of a sore throat, and it was still slightly hard to swallow, but I was on solid food. I was able to get it down. It was absolutely phenomenal. I only spent 2 days in the hospital. The pain was very minimal. The mobility in my neck is incredible, especially just a couple days after surgery. And now we're talking 9 days after surgery, and I have every inch of mobility. I have more mobility now than I had before I went to see him. As you can see, I could turn right, I could turn left, up, down, whatever I need to do. It is, and this is only 9 days after surgery. The pain was very minimal, like I said, and I was off of pain medications within 3 days after the surgery. I was up walking around. I actually went to the hotel. I was on my feet. I was actually going to lunch every day. It was just a wonderful experience. So I went back to see Dr. Bay on Monday the 19th. He looked at everything. He explained everything that was in me. He showed me the instruments. And this is something that right now in this country only Dr. Bay does. He uses instruments that nobody else does. And he also does the minimally invasive surgery like nobody else does. So the reason I'm making this video is to let people know that if you are having any kind of a spine problem, whether it be your cervical, your thoracic, or your lumbar, and you need a fusion, and you see that surgeon, he tells you need a fusion, I want you to know there are more options. There are better options. There are less painful options. There are options that will get you back to working condition, or going back to work, or whatever you want to do. It's all about quality of life. Dr. Bay at the LA Spine Institute is the place to go. He is a phenomenal surgeon. The treatment there, especially at St. John's Hospital, was above and beyond what you could ever imagine. It's just that I can't stress enough that I want people to know that there are more options than a fusion, because the golden standard of repairing the spine is having a fusion. Well, guess what? The golden standard's about to go out the door, because with the artificial disc replacement, it is such a better surgery. And not only that, 7 out of 10 patients that have a fusion have to go back for a second surgery within 10 years. All the studies that have been done on artificial disc to this date has shown that over 90% of the people that have had artificial disc replaced or have put into their system, they have not had to come back for a surgery in that 10-year mark. And who knows if they'll ever have to come back. That's the theory, is that you will never have to come back, because the artificial disc really protects the vertebrae and the disc above and below. And that's what this is all about. So if you can see, the only thing I have right here, I don't know how well you can see it, but I do have my scar here. There's still a piece of tape on it, so I'm still kind of healing there, and I'm still a little bit swollen. But 9 days after surgery, I'm running up and down stairs. I'm able to go in and out of the house. I'm able to drive a car and everything else. And like I said a number of times on here, this isn't about trying to promote the Spine Institute or anything like that. This is about to let you know that you have options. You just take the time to find the right doctor, because you have plenty of options. Now, I'll tell you this, 6 weeks from now, I have to send my x-rays back. And once Dr. Bay looks at them x-rays and everything, if everything is good, I will be able to do basically whatever I want. And if I didn't have the job that I have, he would probably send me back to work, because I'm a police officer, so that's why I can't go back to work right now. It'll probably be 12 weeks before he actually sends me back to work. But anybody else with a normal everyday job, you'd probably be back to work within 6 weeks after the surgery. So please keep that in mind. And like I said, this isn't about promoting the LA Spine Institute or promoting Dr. Bay. This is about to let people know that you have options out there. Artificial disc replacement is here, and it's going to stay here for a long time, and it's only going to get better. So please take the time to look at your options, and don't believe the opinion of one doctor. Thank you, and have a Merry Christmas.